Thanks, Peggy. The first case of the new COVID variant was confirmed in New York State. Patient is a 60-year-old man from Saratoga County who had no travel history. That variant has also been found in California, Florida, and Colorado. Separately, New York Governor Andrew Cuomo said he plans to propose a law that would make it a crime to sell or administer COVID vaccine shots to people who are trying to skip ahead in line. Those providers already risk losing their license, but the proposed law would actually add criminal penalties to that action. The governor also pushed for hospitals to administer the shots faster. He threatened fines for hospitals who don't use their allocated doses by the end of this week. Joining us now is Dr. Kavita Patel, a primary care physician, also a Brookings Institution fellow and an NBC News contributor. She formerly served in the Obama administration. And Dr. Patel, if you were to try to chart this out, the new strain, now that we know California, maybe some of the epidemic proportions we're seeing in Southern California could be attributed to this strain. I don't know whether that's your opinion or not, but it's also in New York. What does it mean for both the vaccine rollouts we're trying and for whether we need additional measures to try to I don't know, mandate social distancing again, lockdown?
Yeah, Joe, good morning. Those are all the right questions. And so we know that the variant that's under study in the UK, and also, by the way, some of the variants that are being picked up in about 20 other countries around the globe, are probably in the United States. That's a global pattern. Just to kind of put it in a little bit of context, however, Joe, I know it's incredibly important to stress that this is more transmissible, just as Prime Minister Johnson said, which means it can translate to more infections, more hospitalizations, and unfortunately more deaths. That's key to remember that we do believe that the vaccines currently available, the Moderna and Pfizer vaccines, are effective against this mutant and against this mutation. So I do feel like in terms of where this is, we know that this is certainly a big part of what scientists are looking at in United States labs. Unfortunately, we only genetically sample about less than 1% of our PCR specimens. Hopefully we now, being on the lookout for this, can do more of that. And then to your point, Joe, it translates to really putting the pressure on not just vaccine distribution and rollout, but kind of simultaneously, those same public health departments that are responsible for that vaccine rollout are the very same public health departments that are trying to stress these social distancing measures. I'm not a fan of lockdowns. I think that the United States is fatigued in general, and I think lockdowns will only do what's happening in the UK and other parts where you're seeing protests that could actually make things worse. I do believe, however, that we need to continue to take a close look and be vigilant. I would argue that in California, I still see shots of people who are all over on social media, who are in parties, who are out and about. We do need to have a little bit more enforcement for some of the current measures that we know working. No household gatherings, no parties, none of these large kind of events that people are still having, Joe. So we have to do both at the same time with incredibly strapped resources.
Doctor, unless you're on scene, I don't know how we know all these things, but we do hear anecdotal evidence that some emergency rooms are overflowing, so people have been put into halls, that people have been transported to different hospitals where they are accommodated. At this point, do you know whether anyone actually has been turned away that needs an ICU or needs really serious medical attention? And if we're here without the new strain being prevalent, should we assume that if it does become prevalent that we will be overwhelmed in some of these areas?
Yeah, that's it. And I think you're hitting on exactly the right point, that this is going to come down to kind of looking at places, region. So let's talk about probably one of the most important regions right now, Southern California. It's where I trained at UCLA. And Joe, right now, they're at 120% ICU capacity. Never been heard of before. People who need ICU level care are not necessarily being turned away, But what they are doing, they literally have ambulances stacked up with a 5 to 8 hour wait, Joe, to get out of the ambulance. And so people are getting triaged, as we call it. But what it looks like right now is nothing short of what you would see kind of in a time of war or in a time of disaster, where people are truly just getting triaged. And what that means is if you need ICU level care because you had a heart attack, it's probably going to be delayed, and that will result to worse outcomes. We actually did see trends like this in Texas recently, and we've also seen it in New York, if you'll recall, as you know, in the beginning of the pandemic. So it is going to be incredibly regional and local. You've got about 2/3 of the country where you're seeing cases decline. And then, unfortunately, in parts of the country where it's accelerating, and maybe it is due to this new variant, in those parts of the country, you're seeing cases rising over a 7-day average in double figures. So we're certainly not flattening the curve evenly across the country. And that, once again, speaks to how in those regions, public health departments are literally on fumes. And they need help to get the vaccines out, which is going to be one of several ways to get out of this pandemic.
Shepard Smith here. Thanks for watching CNBC on YouTube.